Today, on the occasion of Doctor's Day, we have with us renowned cardiologist of India, Dr. Ashwin Tumkur from Yashoda Hospital, Hyderabad. Dr. Ashwin is here to guide us on keeping our heart healthy.
Hi everyone, I am Dr. Ashwin Tumkur, consultant cardiologist at Yashoda Hospital, Malakpet.
Doctor, there are a lot of speculations around sleeping positions related to heart attack. So, which is the ideal sleeping position which is best for one's heart?
The patient who has heart failure will become more dyspneic or have shortness of breath in lying down position, straight lying down. So if patient is heart as a pump is weak, that is we call it as LV dysfunction. They have a lot of breathlessness, so they feel better in little propped up position, that is upright position, maybe 2 or 3 pillows if they keep, they feel better. That is one thing. Overall, if a patient has heart problem, they feel better in right lateral position, right side lying down position. Otherwise, for a general person, he can take any position, that is not a problem.
Doctor, what are the warning signs of heart attack?
Warning signs, the most common symptom of heart attack is chest pain. A person can have chest pain. Typically, it is a squeezing type of pain, type of compression feeling behind our sternal bone. That is, we call it as retrosternal. So, retrosternal pain coming severe, which is for 15 to 20 minutes, and it comes with exertion or emotional disturbance. So, pain is the most common symptom or warning sign for heart attack, and the pain can radiate to, may not remain only to chest, it can radiate to jaws, it can radiate to both the shoulder, left arm, and then jaws. So basically pain coming from the neck up to the umbilicus of the person in the age of, above the age of 35, we always have to rule out angina, that is pain coming from the heart.
Doctor, are there any preventional methods to avoid morning heart attacks?
Prevention is just general prevention, especially if the morning heart attacks are seen in the winter season. So better to keep ourselves warm, and because winter's morning hour there is tendency for the arteries to go into spasm. That is, they become more narrow. So the thing that we can do is keep ourselves warm in the morning hours. So you can do some exercise after getting up from the bed. Some yoga will help, and some meditation and breathing exercise will definitely help to prevent heart attacks in this time of ours.
Doctor, is salt really bad for all of us, especially for heart patients?
So anything excess is always bad for health. So most common thing for patients who are hypertensive patients, we ask them to cut down on salt. So excess of salt, what it causes is it retains water and fluid in the body, and that will cause more pressure on the heart and vascular system. Salt, we advise them to reduce the salt intake, especially patients with high blood pressure, patient with heart failure problems, they need to cut down on their salt. So basically we ask them to, normal person to prevent heart diseases, 5 to 6 gram of salt per day is advisable. If a patient is having uncontrolled blood pressures and heart failure symptoms, blood pressure medicines also you can reduce if you take less salt and keep maintained diet.
Doctor, is it true that most heart attacks happen in the morning?
To some extent, it is true that heart attacks people get in the morning hours. This is because there are some circadian rhythm changes in our body as regards to blood pressure and heart rate. Blood slows down in the morning hours, and that is the reason there is tendency of getting clots formed in the artery supplying heart and other parts of the body. Other thing is there is platelet activation is disturbed in the morning hours. Activation is more, and that is another cause to have more thrombus in the morning hours. To some extent it is true, but a person can have heart attack any time of the day.
Doctor, what sort of life choices will help keeping one's heart healthy?
This is very important. That is the lifestyle modification we advise the patient. Basically, to control the risk factors like diabetes, hypertension, high cholesterol levels, obesity, common risk factors for heart diseases. So, eat healthy, include lot of vegetables and fruits in your diet. Avoid oil, avoid fatty foods, junk foods, because they contain lot of trans acids which are bad for the heart and health. Second thing is do regular exercise, at least 40 to 45 minutes of exercise, at least 3 to 4 days in a week is at least recommended exercise. You need not do vigorous or you need not use high-end gadgets, just jogging, walking, swimming, yogas minimum you can include in your daily activity.